Hello everyone, this is Manpreet Kaur working as the assistant professor in RPIIT. Today we are going to discuss the National Mental Health Policy. So first of all is introduction of National Mental Health Policy. The attitude toward the mental illness and the treatment of the mentally ill have undergone considerable changes through the years, where before the mentally ill were often beaten, tortured in order to make the body unsuitable places for the demon. The organization of the mental health services demand a wide variety of the intervention regarding the public awareness, early identification, treatment for illness, family education, and long term care, rehabilitation, and ensure the human rights of the ill person and to create more awareness of the mental health among the rural people. National mental health policy was started in 1982 in Maharashtra by the government of India. The slogan of the national mental health policy is reaching the unreached. So next is definition of mental health. So, mental health, according to WHO, mental health is a state of well being in which the individual realizes his or her own abilities, can cope with the normal stresses of the life, that can work productively and is able to make a contributions to his or her community. So, mental health की डेफिनेशन WHO वर्ल्ड हेल्थ ऑर्गेनाइजेशन ने ये दी है कि पर्सन को हम तब भी वेलबींग स्टेट मान सकते हैं जब कोई व्यक्ति जो है खुद की रिस्पॉन्सिबिलिटी को समझे और उसको डेली लाइफ में आने वाली जो भी प्रॉब्लम्स हैं, स्ट्रेसर्स हैं, उनसे वो कोप करके अपनी लाइफ को ज़्यादा प्रोडक्टिव बनाए ताकि उसका कॉन्ट्रीब्यूशंस जो है वो कम्युनिटी में आ सके. उसको क्या बोलते हैं? मेंटल हेल्थ बोलते हैं. सो नेक्स्ट इज डेफिनेशन ऑफ mental illness. Mental illness is a medical conditions that disturb the person thinking, feeling, mood, ability to realize to other and daily functioning. Mental illness are medical conditions that often result in damaging capacity for the coping with the ordinary demand of the life. जब एक ह्यूमन बीइंग की जो ऑर्डिनरी डिमांड्स हैं डेली लाइफ की, उनकी कॉपिंग मैकेनिज्म जो है वो ख़त्म हो जाती है और एक ऐसी मेडिकल कंडीशंस बन जाती है जिस पे पर्सन की थिंकिंग, मूड, फीलिंग्स और एबिलिटीज़ जो है वो डिस्टर्ब हो जाएं. उस कंडीशंस को क्या बोला जाता है? उस कंडीशन को हम मेंटल इलनेस बोलते हैं. सो next is definition of national mental health policy. So according to WHO, mental health policy describe the value, object and strategy of government to reduce the mental health burden and improve the mental health. So अकॉर्डिंग टू WHO, ये डेफिनेशन भी WHO ने दी है. इनके अकॉर्डिंग जो गवर्नमेंट की पॉलिसीज़ हैं, वैल्यूज़ हैं, ऑब्जेक्टिव्स हैं, स्ट्रेटजी हैं, उनको डिस्क्राइब करना, उनको एक्टिवेट करना ताकि जो मेंटल हेल्थ का बर्डन है उसको कम किया जा सके और इम्प्रूव की जा सके मेंटल हेल्थ हर इंडिविजुअल की. सो नेक्स्ट इज़ magnitude of mental health problems. So magnitude of problem is, as per the census 2011 or 16 updated, there now it's updated, there are 72 million peoples are suffering from the same form of the mental illness, ranging from the depression to schizophrenia. And according to the world organizations, its mental health report of 2011, less than 1% of the total health budget is spent on the mental health in India also lacking in the mental health profession. According to the report, there is just one psychiatrist for every 3.4 lakh peoples, and the policy aim to provide the universal psychiatric care to the entire population. Next is mental health services at the various level. There are four main levels of the mental health services, that is the central level. In central level, national health hospitals, for example Nimhas, Bangalore. And second is the state level. In state level, there are state level hospitals, for example institutions of the mental health, Karnataka, Tamil Nadu. And national mental health program is also undergone into the state level hospital. And third is the district level. District level, there are general hospital with the psychiatric unit, and district mental health program is also under in district level. And last or fourth level is the local level. There may be a primary health center, community mental health centers, and sub centers are included in fourth level, that is the local level. So next is National Mental Health Policy. A mental health action has been launched by the government of India by blocking by the mental health action plan, that is the 365, which highlighted the role of the central and state government, media and civil society organizations. The policy is attempt to decrease the treatment gap and disease burden and extended of the disability due to the mental illness by the integrations mental health and the journal health and intersectoral coordinations focusing on the illness and disability and promotion of human rights and reform in mental hospital, response to the need of the vulnerable groups and including the women, children, homeless people, and support for the caregivers and their family members. So next are the major highlights of the national mental health policies are: a national mental health policy underwent the major strategy revisions over its course starting from the setting a district as the unit of the program planning and implementation under the district mental health program to incorporating it with the national rural health missions for the effectively scaling up the programs. So there are four major programs are: the more emphasizes on the funding, a new policies emphasize the need for the more fund allocations in the total health budget, including the social welfare, school education, and women and child development, so as to handle the mental health appropriately for all. So next is emphasis on caregivers. So the policy aim to the give family members access to the informations and guided access to the specific services, identify the vulnerables group. Next aim is to identify the vulnerables group. The policy emphasis also emphasizes that there are certain sections of the populations who were more vulnerable to the mental issues, like people suffering from the mental health, among the poor or the homeless, people in custodial institutions, or children and the elder, including the sex worker or the victim of the human trafficking. And next is promoting awareness on the problems of mental health, focus on the need to the create awareness among the peoples on this problem and how it to be prevent. And next is policy aim to decriminalization suicide, aim to decriminalize attempt suicide, which is at present considered as punishable offense in India.